Today I am going to present a case of sheep. Basically, this case is very interesting, and that case is related to a metabolic disorder in sheep that is very common during the advanced pregnancy. First of all, I will present a case, will make a tentative diagnosis, and then I will explain the treatment plan and pathogenesis of that specific case. So what was the case? Basically, a pregnant sheep was presented at the clinic with a chief complaint of teeth grinding, disinclination to move, stumbling gait that is followed by recumbency, partial anorexia, and mild depression. From this chief complaint, you came to know that there are some nervous signs in the sheep, means tooth grinding and stumbling gait. So these are very typical signs that will help us in making a tentative diagnosis. So moving towards the history of that case, the owner said that she observed these cases around 2 days ago in that sheep. First of all, she start losing her interest in the feeding. And when I asked about that, what he is feeding her, he said that he is feeding her green fodder only. And when I asked about her pregnancy status, he said that she is in her advanced pregnancy. Only around 10 to 15 days are remaining in her imminent parturition. And he also has her ultrasound report along with him. And ultrasound report says that there were two fetus in the uterus, and fortunately, all of these two fetus were alive. And when I moved towards a general examination of that sheep, the behavior of that sheep was mildly depressed, or she was obtunded, means she was showing some nervous signs, and her gait was stumbling, and she was frequently sitting, means she hardly walks 2 to 3 steps and then suddenly she sits down. This indicates that she's suffering from some sort of deficiency. It could be hypocalcemia or it could be hypoglycemia. When we will tentatively diagnose this case, then we will come to know either it is hypoglycemia or it is because of hypocalcemia. The posture of that sheep was not fine because she was in sternal recumbency because of deficiency, and rest of the general examination findings were normal in that sheep. When I moved towards the physical examination of that sheep, first of all, I took the vitals of that sheep, and the vital says that her temperature was slightly lower than the normal, heart rate was higher than the normal, respiration rate was also elevated, and her conjunctiva was slightly pink. The slightly pink conjunctiva indicates that she was also slightly anemic, and rest of the parameters were normal. But one of the most important parameters that I noted in that sheep is sweetish smell in her breath. That parameter basically led me in making my tentative diagnosis. I will explain that why and how I make my tentative diagnosis on the basis of this sign. So the remaining things were normal, feces were normal, urine were normal according to history from her owner. And in the miscellaneous, I also observed that the sheep was disinclined to move. When I put pressure on her back, she was not ready to move from her place. That indicates that she is suffering, she is very much depressed and suffering from some sort of deficiency. So depending upon all these things, the history, the clinical examination, the general examination, and the ultrasound report, which says that she is in her advanced pregnancy and there were two fetus in her uterus, I make my tentative diagnosis that she is suffering from pregnancy toxemia. Why I make this tentative diagnosis? Because all the signs which were present in that sheep are typical for pregnancy toxemia. What are these signs and what are these history points? The first and foremost history point is that she is in her advanced pregnancy. That is very typical finding in pregnancy toxemia. I will explain that why it is very much typical finding in pregnancy toxemia. And second, the most important thing that helped me in making my tentative diagnosis is sweetish smell. Because in pregnancy toxemia, there is formation of ketone bodies, and these ketone bodies come into the breath and make the breath sweetish in smell. And the third sign that helped me to make tentative diagnosis of pregnancy toxemia is grinding of teeth. Because when these ketone bodies cross the blood-brain barrier and damage the brain, animal will show nervous signs which include grinding of teeth and obtunded behavior. And the last sign that helped me in making tentative diagnosis was frequent lying, because she was suffering from hypoglycemia, which is very common in pregnancy toxemia. She was not able to stand because she was lacking energy because of hypoglycemia. That's why she was frequently lying on the ground. So these are very typical findings that can help you to make a tentative diagnosis of pregnancy toxemia in any sheep or in any goat that is in her advanced pregnancy. So then moving towards the differential diagnosis of this disease, that from which diseases we have to differentiate pregnancy toxemia. Basically, all those diseases which show nervous signs, just like pregnancy toxemia, we have to differentiate them from pregnancy toxemia. The first disease is hypocalcemia. How we have to differentiate? Hypocalcemia is basically an acute disease. Its course of disease is very less. The course of disease in case of pregnancy toxemia is 3 to 4 days, but in case of hypocalcemia, it is hardly 12 hours. And in hypocalcemia, you will see very obvious myasthenia of the muscles. The muscle become very weak and flabby because of lack of calcium. Because calcium is responsible for contraction of the muscles. When there is hypocalcemia, muscles become flabby, and this condition is called as myasthenia. Then we have to differentiate from listeriosis. How we have to differentiate from listeriosis? In listeriosis, you will see unilateral facial paralysis and elevated body temperature because it is a bacterial disease. Then the third differential is GID or cerebral cyanosis. In cerebral cyanosis, you will find normal temperature and you will not find any history of advanced pregnancy, or you will also not find any history of frequent lying and disinclination to move. In cerebral cyanosis, animal is perfectly fine and he is responsive and active. The only sign he is showing is circling. And fourth differential is acidosis. In acidosis, animal also show nervous signs because in acidosis there is production of lactic acid which crosses blood-brain barrier and damages the brain, which lead to nervous signs. And then how we have to differentiate it from pregnancy toxemia? In acidosis, basically the pH of blood drops. It is less than 5, and there is a history of grain engorgement. And the fifth disease which we have to differentiate from pregnancy toxemia is uterine torsion. In uterine torsion, you will find a history of abdominal pain and frequent kicking at the abdomen. And the last differential of pregnancy toxemia is rabies. In rabies, you will see that animal is hyperactive and paralytic. If there are basically two forms of rabies, one is furious rabies and one is paralytic rabies. In paralytic rabies, the animal will be paralyzed, but in furious rabies, animal will have attacking behavior and he will be urinating and defecating again and again, and his ears will be pricked and he will be pine because he is hyperactive in rabies. So these are the differential diagnoses of the pregnancy toxemia. As far as the treatment of pregnancy toxemia is concerned, as I told you that during pregnancy toxemia, there is hypoglycemia in the blood. There is decreased level of glucose in the blood. So our foremost role during treatment is to provide a source of glucose to the animal. For that purpose, we inject dextrose 5% and dextrose 25%. How we have to inject? We have to take 1000 ml dextrose 5%, and in that 5% dextrose, we have to mix 4 ampoules of 25% dextrose and then inject it to the animal through IV route. And it must be a slow speed drip. And then we also have to provide Milfon C. This is basically a calcium borogluconate because it is a case of advanced pregnancy. So in order to rule out hypocalcemia, we also inject calcium borogluconate, which is coming in the market with the name of Milfon C. Then the fourth medicine that we have to inject in pregnancy toxemia is some liver tonic, because during pregnancy toxemia, there is increased pressure on the liver because during pregnancy toxemia, the liver provides energy to the animal by metabolizing fatty acids. When fatty acids are metabolized in the liver, there is increased stress on the liver, due to which liver's function is compromised. So in order to support the liver, we have to must inject some liver tonic, which could be Hepagard, Hepagen, Jetipar, or so on. And the last treatment is propylene glycol. We have to provide some continuous source of glucose to the animal, because the first source, which is dextrose, it will not fulfill the requirements for long time. It will fulfill requirements for a day or two. For long time, we have to provide propylene glycol. We have to daily provide 100 ml of propylene glycol to the sheep. Because why propylene glycol? Because propylene glycol is basically a precursor of glucose. When it goes into the intestine, it is absorbed into the blood, it goes into the liver and metabolized into glucose. That glucose will be ultimately provided to the sheep and she will become fine. So this is basically treatment plan of pregnancy toxemia. And the second option that we have in pregnancy toxemia cases is induction of parturition. But remember that you do not have to induce the parturition if the pregnancy is less than 140 days. You know that normal pregnancy gestation length of sheep is 150 days. If the gestation length is or pregnancy time is more than 140 days, then you should go for induction of parturition, otherwise not. Why not? Because if you induce parturition before 140 days, the fetus will be premature and it will not be able to survive. So this is basically the treatment plan of pregnancy toxemia. Now moving towards the pathogenesis and predisposing factors of this disease, that when this disease and why this disease happens only in advanced pregnant sheep. So basically, during advanced pregnancy, there is very fast growth of the fetus. Almost 60% of the growth happens in last 6 weeks of pregnancy. Due to that fast growth of fetus, there is increased demand of glucose by the fetus. When there is increased demand of the glucose by the fetus, all the glucose will be shifted towards the growth of the fetus and only a small amount of glucose will be remaining for the sheep as itself. That's why she will suffer from hypoglycemia. And second predisposing factor is that during advanced pregnancy, there is large size of fetus that put pressures on the rumen cranially. When the large size of fetus puts pressure on the rumen, the volume of the rumen is decreased. Due to that decreased volume, the animal will eat less and he will suffer from anorexia. When animal will eat less, there is less production of volatile fatty acids, and out of these volatile fatty acids, one of them is propionate. So when animal suffers from hypoglycemia due to increased demand by the fetus, the body shift towards another source of energy, and that source is fatty acids. So when there is no glucose in the blood, the body will prefer to use fatty acids. The fatty acids will be shifted from peripheral tissue into the liver. When they come into the liver, they will be metabolized into acetyl-CoA, and that acetyl-CoA will go into the Krebs cycle and will generate ATPs. But during pregnancy toxemia, this acetyl-CoA cannot enter into the Krebs cycle. Why it cannot enter into the Krebs cycle? Because for entering into the Krebs cycle, acetyl-CoA also needs oxaloacetate, and oxaloacetate comes from propionate. But I told you that during pregnancy toxemia, animal is eating less. That's why there is less production of propionate. When there is less propionate, there is less oxaloacetate. If there is less oxaloacetate, acetyl-CoA cannot enter into the Krebs cycle. So acetyl-CoA takes another pathway, and that pathway is basically production of ketone bodies. So this is the reason that why ketone bodies are produced during pregnancy toxemia. And when these ketone bodies are produced in the liver, they enter into the blood, reaches the brain, cross the blood-brain barrier, damages the brain. That is responsible for typical nervous signs in pregnancy toxemia. And out of these ketone bodies, one ketone body is acetone. It is sweetish in taste and smell. And when this acetone comes into the breath, this gives a typical smell to the breath, which is sweetish smell. That's why that sheep was presenting sweetish smell. So this is very brief pathogenesis of pregnancy toxemia. And if we talk about predisposing factors, that which factors can predispose sheep towards pregnancy toxemia, these include twins or triplet pregnancy, because when there is twin or triplet, there is increased demand of glucose. When there is increased demand of glucose, animal will suffer from hypoglycemia. In advanced pregnancy, there is large size of fetus, which puts pressure on the rumen. The capacity of rumen decreases, animal will eat less and will suffer from hypoglycemia. And then is low energy diet, when we provide only roughages or green fodder, which is very low in energy, animal will suffer from hypoglycemia. And I told you that in that specific case of sheep, the owner was providing only green roughage, which is a green fodder, which is a very poor source of energy. And then change of environment, when we change the environment of a pregnant sheep, she will suffer from stress and will eat less. When she will eat less, she will suffer from pregnancy toxemia. And the last predisposing factor is winter season. What happens in winter season? During winter season, animal utilize most of its energy towards maintaining her body temperature. When that energy is utilized towards maintaining body temperature, only small amount will be remaining left for the sheep itself. That's why she will suffer from, again, hypoglycemia or pregnancy toxemia. So this is very brief pathogenesis and predisposing factors of pregnancy toxemia. Hope you find this case very helpful, and it may be helpful for diagnosing pregnancy toxemia cases in sheep and goat in future. Oh, thank you.